When you're in home care, you see people where they live, whether they're rich, whether they're poor, whether they're conservative or liberal, whether they have, a pristine home or one that's kind of crazy. You get to see them where they live and address their needs on their level.
Okay. Everybody's going to see this video too, right?
We put our heart into the care that we give at Lifecare Oklahoma, whether it's through our home health, our hospice, or our personal services.
Oh, they call me their cheerleader because I talk Lifecare all the time, just like I talk the Bible. And they even brought me some pom-poms.
Patients, or these people, need medical care. They're all sick, coming out of the hospitals very sick, but they need more than just medical care. They need someone to care about them as a person, because they just need somebody with a little bit of extra time because they don't have anybody. They need someone to know that they're there, to spend a little time with them. They're lonely, a lot of them.
This is a very difficult decision for them. They've been independent their whole life. They're having to face end-of-life issues.
Well, being as smart as I have been and being a boss of a lot of people, I didn't think I needed any help. But I really needed help worse than I thought.
Even when we go home, we don't shut it off. Our patient's pain never stops. We don't stop thinking about them. We constantly want to think what we can do better for the patient.
It's not just a job for me. It's my calling, I would think. And I think that I bring that in there, and I think that's why.
If Lifecare is epitomized by the people that work for them, you can't go wrong, because they're very, very nice and very talented, and you get the very best care, I believe.
When Lifecare comes to give care, they give so much more than care. They give feeling. They give heart. They give compassion.
Because for them, their profession as nurses, as therapists, as home care aides, it's a calling for them as opposed to being a job.
I handle the loss of my patients by knowing that I'm more blessed by knowing that I was able to help them through that last little bit. Sometimes it's really rough, sometimes it's not so bad, but I get through it by knowing that I helped them through the toughest part of their life.
As a nurse, you encounter death on a fairly regular basis. Through hospice work, your job is to help somebody through that process, to help a patient and to help their family through that process.
And I was also with her on the day that she died, and to have the hospice nurse sitting there rubbing Grandma's arm, and to have inspirational music playing in the background, and to see her take her last breath, but she was in peace and pain-free. It was peaceful and it was calming. It was a sense of tranquility. And that's what I believe hospice is supposed to be about, to bring comfort and a sense of release to families, and that's what hospice did for us.
Our excellence is inspired by you.
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 All I want is their love. And Lifecare has lots of that along with their medical supplies. They have a lot of love in those bags they carry around.